Members who are using a phone connection only should speak up when I call for any other discussion on the item. Because conversations among several people by electronic means can be cumbersome, we should limit our discussions to the business items and issues directly related to the business items. I ask that the members again state their names when they're speaking to ensure members of the public can follow our discussion with ease. Please refrain from talking over other speakers. When you participate in discussions, please speak directly into the receiver microphone so I, the other council members, and the public can hear all discussions. When you make a motion or second a motion, please state your name so I know a motion has been made and seconded, and the recording secretary can record this information for the minutes. Because we are conducting the meeting electronically, all votes must be taken by roll call. When we do so, Jenna will call the roll in alphabetical order. I, the other council members, and the public must be able to hear your vote. When your name is called for each vote, please clearly state yay or nay or abstain so I can determine whether a majority voted in favor of the motion. During the course of the meeting, if you leave the location from which you are participating, please inform me of your absence at that time so I can ensure a quorum continues to exist during the meeting. Are there any questions before we proceed? If not, I'm going to, Jenna, take a roll call to ensure that we have a quorum. Jenna, can you call the roll?
Atlas Ingebrigtsen.
Jenna, you're very quiet.
Atlas Ingebrigtsen. Okay, Chambliss. Councilmember Chambliss, are you there?
Jenna, we're having a tough time hearing you.
Let's see. Okay, I'm off mute. I'm just not loud enough.
Yeah, that's the audio is just not clear.
Okay. Okay, can you hear me now? No, shoot.
Oh, that I heard.
Okay. Okay. Atlas Ingebrigtsen.
That was clear.
Chambliss. Cummings.
Here, I think that was coming here.
Yep. Ferguson.
Here.
Brunson.
Here.
Gonzalez. Councilmember Gonzalez.
Here.
Turner.
Is that Sterner?
Yep.
Here.
Zoran.
Present.
Atlas Ingebrigtsen, I see that you're on.
Here.
And then Barber.
Here. All right, seeing that we do have a quorum, I will call the meeting to order. Our first order of business is approval of the agenda. Is there a motion to approve, or does anyone have any changes or additions to the agenda?
So
If
moved.
not,
This is
okay.
Atlas Ingebrigtsen.
Moved by Atlas Ingebrigtsen. Is there a second?
Second, Chambliss.
Seconded by Chambliss. Jenna will call the roll. I believe she's calling in by phone now, so we might be able to hear it better. So Jenna, if you could call the roll, please. We'll give her a minute. The joys of technology.
Can you hear me now?
I can hear you.
Okay. Atlas Ingebrigtsen.
Aye.
Chambliss.
Aye.
Cummings. Ferguson.
Aye.
Brunson.
Aye.
Gonzalez.
Aye.
Sterner.
Aye.
Zoran.
Aye.
And Barber.
Aye. And the motion carries. Next, we move on to approval of the minutes. I would like to move both the minutes from the March 9th meeting and the March 23rd meeting together. If I could entertain a motion to approve the minutes from those
So
two
moved.
meetings.
So moved, Fredson.
Moved by Fredson. Is there a second?
Seconded, Atlas Ingebretson.
Seconded by Atlas Ingebretson. Jenna, can you call the roll, please?
Alice Ingebretson,
Aye.
Chambliss,
Aye.
Cummings, Cummings, Ferguson,
Aye.
Fredson,
Aye.
Gonzalez,
Aye.
Sterner,
Aye.
Zurin,
Aye.
Barber,
Aye.
and then Councilmember Cummings again.
I see her still on the line, but we'll see if she's can connect later. But the minutes are approved. Next, we are on to MTS Virtual Reports. We have MTS Director Thompson.
Madam Chair, this is Nick, and council members, this is Nick Thompson, or Director of MTS. Can you hear me?
Yes.
Thanks. A couple announcements tonight. At 2 o'clock this afternoon, the governor and Chair Zelli announced our latest expansion of our contracted service to provide essential healthcare workers door-through-door transit service that is starting today using our fleet of Metro Mobility vehicles that are available because of our reduction in ridership that we're experiencing on Metro Mobility. So this, knowing that we've made cuts in our reductions in our transit service across the region, we had identified a need that some of the essential healthcare workers or those working at health facilities had lost some of their options for transportation services. And so we will start using our Metro Mobility service to provide door-to-door service for anybody in the healthcare industry that is going to a healthcare facility. And we're able to provide that, we think, 24/7 operations. And so they would, what was announced today is that they would be able to book their ride just like a Metro Mobility customer would. And they will book that through our Metro Mobility service, and they can find which phone numbers to call on our website. And we're also have a pretty comprehensive communication plan where we're working with the health providers to get this information out to us. We think this is a good use of our transit services to provide this essential service to those on the front line that are providing what's needed for response to COVID. A couple just minor details of how it will work. They'll call 1 to 4 days in advance, like Metro Mobility. We might even have some ability to do same day calls for that service. And then once they book a ride, we'll guarantee that we'll also have a return ride for them that after their shift is over. All they'll need to do is, once they book their ride, is when they board the bus, show us their health, their badge, employment badge, so we know that they're connected to a health provider. There is no charge for this service for the ride. And unlike Metro Mobility, we'll be allowing up to 2 or 3 health care workers to ride on the same, rather than on Metro Mobility, we're just providing single ride. We think we can safely provide this with social distancing on our bus. So that gets rolling today, and we're happy to provide this service. If over time we find that there's still capacity to deliver more, we can look to expand it to other essential workers that are in the workforce that may have some transit needs. We've also continued to expand our food delivery service, which we updated you on full council last Wednesday. We originally started that in Ramsey and Hennepin County. This week, we've expanded orders to all 7 counties. We had deliveries that started today in Dakota County, so that is expanding. We are working closely with our each county and staff within the county to connect us with the right food shelves. And so we've been providing grocery and food shelf delivery, but almost all of the deliveries are turning out to be the food shelf delivery. We had over last Friday, I think our most 293 deliveries on Friday. So that's one that continues to grow. It seems to be working out well. Ridership wise, we continue to be fairly reached a stable point for Transit Link and Metro Mobility, where it looks like we're about off by 75 to 80% of our norm, but that seems to be holding steady, and that appears to be mostly essential trips for medical or work. And so we're glad that public is responding to those requests to go to essential services on those. And lastly, TAB does meet this week, and they have one main action item is to decide whether the regional solicitation the application deadline should remain May 15th. After meetings with TAC and staff, the recommendation will be going to TAB that they keep that May 15th deadline. All our local partners that have weighed in through surveys and communicated today in a special meeting of TAC said they believe that they can make that commitment of May 15th for deadline. So that is good news. But they did ask that the parallel regional solicitation process for highway safety funds, which is administered by MnDOT for the 7-county region, they extend that deadline from May 15th to July 1st to spread that out. And so expecting that TAB will entertain both of those actions this week. And so that does mean that the federal funding should be approved to go out this year yet on our schedule. With that, Madam Chair, that concludes my report, and happy to take any questions.
Thank you, Director Thompson. Are there any questions from council members?
Chair Barber, this is Councilmember Atlas Ingebretson. I have a quick question.
Councilmember Atlas Ingebretson.
First, Nick, I just want to thank you and the team, and please pass along kudos for all the wonderful things that are being provided during this really challenging time. I'm just curious, are we providing any additional financial support to the drivers who are going to be, who are driving at this time? Or are they getting any bonuses or hazard pay or anything like that to acknowledge the added risk that they're in for the services, the vital services they're providing?
Madam Chair, Council Member, at this point, we have not authorized any added payments, though contractors themselves have the ability to increase wages if they want to within their contracts. I have not heard any indications at this time that they are doing that, but it is a question that has been asked several times and is under consideration at the state level, I believe, and at being debated. So it's something that if there's action for that, we will evaluate and consider that.
Thank you. Any other additional questions? All right, then we'll move on. Thank you, Nick. We'll move on to General Manager Koistra, and I believe he's on the phone. Wes?
Madam Chair, can you hear me?
I can hear you.
I have a few things to report as updates to some of our work related to the pandemic. I will say again that protecting our riders and frontline employees, our operators, our police officers, our maintenance staff continues to be our primary focus right now. Employee morale remains good overall. But the pandemic is starting to hit even closer to home. Last Thursday, we had our first employee with a confirmed case of COVID-19, and today we received word of a second confirmed case. I'll mention that in both instances, the individuals were in route training status and had not provided any revenue service rides. So we're thankful for that. Per the protocols, we immediately informed staff. We placed employees with close interaction with the persons who were tested as positive on paid COVID leave, and we immediately initiated advanced cleaning efforts. And there are very specific protocols in place for communication, for communication with our employees, and for communication with Department of Health and other communication, and there's very specific protocols for cleaning that we follow in both cases. We're seeing an uptick in absences. About 350 people are on our sick list for bus. 41 people are on COVID leave for the LRT, with 66 operators out in total. We need a minimum of 70 LRT operators to cover our already reduced service, and right now we're at 75 operators. Currently, we can still cover the work because of the service reductions already in place, but we will likely need to make more service adjustments as our sick lists continue to grow. Metro Mobility Department is also seeing a reduction in officers available. Prior to the pandemic, we had 40 part-time officers. Now we have only 3. The reason for that is that the part-time officers have home departments that they work for around the region, and those departments are not allowing them to work for transit, given a lot of the hands-on situations in transit work. So we're down from 40 part-time officers to 3. This leaves us with about 16 officers at any given time to cover the whole system. In terms of ridership, in general, one of the most important things we can do is protect our frontline staff. Is to continue to convey that the message that transit is for essential travel only. And we are also saying that even for essential trips, people who have viable non-transit options should not be riding transit. And thankfully, we're continuing to see low ridership. This past week, system ridership was down about 70%, and this is fairly consistent with last week. So similar to what Nick Thompson was seeing in his service areas, we seem to be having a steadying ridership with a system-wide downtime of 70%. That ranges from close to 70% for bus to up to 98% reduction in ridership for North Star. Unfortunately, we're continuing to see a large number of biohazards on light rail. The report for the last 2 days was around 10 or 11. As far as additional steps we're taking, last week we partnered with ATU to begin distributing non-medical masks to our essential employees. And those have not come in as fast as we would have liked them to come in from the vendor, but we are distributing those as fast as we can, and people are appreciative of that. We're also encouraging the public to cover their nose and mouth while riding, and this follows the evolving CDC guidance on masks. Initially, we had N95 masks on hand. We had purchased N95 masks in anticipation of something like this happening, but we were asked not to distribute those masks to operators and rather donate them to the state emergency operations centers for frontline healthcare workers. We've donated about, as I mentioned the other evening, about 9,000 masks to healthcare workers. In general, every day we're talking about what more we can do for our frontline workers. We have meetings each day, each morning, and that's the focus of our discussion. And we also are looking closely at what other transit agencies are doing. We have a report each day that tracks changes in service and changes in strategy from transit agencies across the nation. And that's been really helpful for us to anticipate issues we're going to be confronting as we look at transit agencies, for example, on the East and West Coasts that are a little ahead of us in the progress of the pandemic. So I'll accept any questions, and that's the end of my report.
Thank you, General Manager. Are there any questions from council members?
Madam Chair, could I ask a question?
Oh, yes, Councilmember Zarin.
Thank you, Madam Chair. Wes, you mentioned that ATU Local 1005 partnered with us to get non-medical masks. Could you speak a little bit more about that? I'm understanding there's a financial arrangement there, and could you spell that out for us, please?
Sure. Madam Chair, Council Member, originally they spoke to us about that they had found a vendor for masks that they'd like us to participate financially in the purchase of those masks. And this is prior to the CDC issuing further guidance on and further recommendations for the use of masks. So we had originally had an arrangement that each party would pay half for the mask, but when CDC came out later recommending the use of masks, we informed ATU that we wanted to pay for all the masks. So the financial arrangement is that they found the vendor and we're paying for the masks.
Thank you. Any additional questions for General Manager?
Thank you, Wes.
Any more questions from council members? All right, thanks, Wes. Then done with that, we're going to move on to our agenda. There are no items on consent tonight. We have one business item. It's business item number 2020-110. Dakota County and Washington Southeast Ramsey County Transit Link contracts. And we have Sheila Williams here to present it.
Good afternoon, Madam Chair, committee members. Can everyone hear me?
Yep.
Okay. Thank you very much. So TransitLink is the Met Council's general public dial-a-ride service, providing transit service throughout the region where access to our fixed route bus and rail network is not available. The region is divided into 5 service areas for ease of operation and administration. MTS, Metropolitan Transportation Services, competitively procures services for each service area using a series of multi-year contracts, which allows the opportunity for vendors to propose and operate transit service on behalf of the council. The action before you this afternoon is to award contracts for Dakota County and Washington Southeast Ramsey County service areas. MTS combined the Dakota and Washington Southeast Ramsey service areas into a single procurement to increase the size of the procurement, to improve proposal quality and price, and to ensure quality service delivery over the long term. A request for proposals was released on February 12, 2020. There were 7 registered plan holders. 3 proposals were received and evaluated by a 5-member panel with representation from Metropolitan Transportation Services, Scott and Washington counties. All proposals were evaluated using 4 criteria: quality of each proposal, proposal qualifications, experience, compliance with the RFP, and proposed price. First Transit had the highest rated technical scoring along with the highest rated cost for services for the 5-year term. The evaluation panel unanimously determined that First Transit is the best value to the council to award the Dakota and Washington Transit Link services. In a few months, First Transit will be transitioning out of the Metro Mobility South Zone contract and proposed its current facility and management personnel for both Transit Link contracts, which may result in a smoother service transition. So the proposed action is that the Metropolitan Council authorize the regional administrator to negotiate and execute a contract with First Transit Inc. to provide Transit Link dial-a-ride services from September 28, 2020 through August 31st, 2025 for the following: contract 19P225 for service in Dakota County in an amount not to exceed $8,147,378. And 2, contract 19P2222 for the service in Washington County and Southeast Ramsey County in an amount not to exceed $10,463,939. With that, Madam Chair, I'd be happy to take questions.
Thank you, Sheila. Are there any questions from council members? And if you could raise your hand. Councilmember Cumming.
Thank you, Madam Chair. My question is, given that the solicitation went out in the middle of February and the responses were received prior to the extreme measure that we're having to take, do you think that had this gone out later, or had this not been, the timing been such that it turned out to be that the responses in consideration would be different, or would the contract be written differently, or what effect would COVID-19 and all the changes in service have, do you anticipate?
Madam Chair, Council Member, I'm going to defer that, if you don't mind, to either Director Thompson, and we also have John Harper, who's the Manager of Contracted Transit Services on the line.
Madam Chair, this is Nick Thompson. Can you hear me?
Yes, I can.
Yes, that's a great question. I think we would probably, these contracts are ones that develop over many months before we actually release the RFP. So I think we had the number of bidders that would have bid on the project in normal times. What we're seeing with our contract language and our existing contracts is that we do have the flexibility to modify our operations in a situation like we have now. So I think even if in the long term we're seeing a change in operations, we can continue with this procurement because we have some flexibility to renegotiate if needed. The other thing on this is there is a timing issue in that this is a contract that is replacing an existing contractor where that contract expires. And so we're on a fairly tight schedule to get the new award, contract award, so there's no gap in service on these contracts. I hope that answers your question.
Thank you, it does.
Are there any other questions from council members? All right, if not, I would entertain a motion to approve business item 2020-110.
Cummings moves.
Moved by Cummings, is there a second?
Second, Chambliss.
Second by Councilmember Chambliss. Any other discussion? Jenna, can you call the roll, please? Jenna, could you call the roll? You hear us?
How's my sound now? Can you hear me?
Yes, I can.
Okay. Allison Gebretson.
Aye.
Chambliss.
Aye.
Cummings.
Aye.
Ferguson.
Aye.
Fredson.
Aye.
Gonzalez. Gonzalez. Turner.
Aye.
Zurin.
Aye.
And Barber.
Aye. And that the motion carries. Thank you very much. Next, we're on to our information items. Well, actually, we have to make a decision as to whether that can proceed on consent. I think that can be moved to the full council on the consent agenda, unless anyone disagrees with me. All right, we will move it to consent. Next, we're on to our information items. We first have highway and transit travel reductions due to COVID 2019. We have Jonathan Ehrlich and Ashley Asmus and Eric Wind.
Hello, this is hello, Madam Chair. This is Jonathan Ehrlich. I'm Manager of Travel Modeling and Research at MTS, and I just wanted to introduce Ashley Asmus, who is a new data scientist at the council and at MTS. She started at the beginning of January, and she's going to present this innovative work that we've been working on for the past month, and myself, she and Derek Lynn from Metro Transit will be available to answer questions at the conclusion.
Okay, thank you and welcome to the council.
Hi, thank you. Thanks, Madam Chair. Thanks, committee. So I'm just going to give you a brief overview of the research that we've been doing in collaboration with Metropolitan Transit and MnDOT. You can go to the next slide, please. So the motivation behind this work really came from both internally and externally from the state. We got an email in mid-March from the Minnesota Management and Budget Office asking us and also Metro Transit and MnDOT if we could provide them some sort of real-time measures of the impacts that their policies were having on social distancing in the state and in the metro. And they also wanted to see if we could give them data that, see if they could give them data that would inform disease modeling efforts. They wanted some, some numbers that would estimate how frequently people were coming into contact with each other, because that measure directly feeds those models that we've heard so much about that are projecting how this disease will play out in our communities. And, we had on hand some traffic and ridership data that provide almost near-time measures of change and responses to these policy efforts. We had some existing research and some really innovative ways, I think, of looking at these traffic data that we quickly retooled to suit the state's requests, and also just to get as many valuable insights as we could during this time. Go to the next slide. And please feel free to stop me if you have any questions along the way. So we had three main sources of data going into this. The Minnesota Department of Transportation had some research that they were doing with about 100 automated traffic recorders that are spread across the state on really various kinds of roadways, so small rural roads, but also big freeways. And at the Metropolitan Council, I was working with traffic sensors that are built into the metro area freeways. So these are usually used to measure congestion and traffic. I don't know if you're all probably familiar with those like red, yellow, green congestion maps that MnDOT produces that show you how bad congestion is in the metro area. We were using the same data, but to look at changes in ridership over time. And Metro Transit had their automated passenger counters that are installed on buses and rail lines. And all of these were providing like really real-time data. So that we could get insights to the state as quick as we could. Go to the next slide. So this is a map of all those 1,000 sensors in the metro area. There's actually a few in Rochester as well. Each of those points is a different traffic sensor. And this is just a screen grab of an interactive mapping application that we've made open to the public. The link is over there on the right. Greg, I don't know if you want to try to click on the link. If not, we can just keep moving forward. I've got some other screen grabs here. Okay. So you can play with the mapping application on your own. And then this is the graph that we're providing the governor's office every day. And so we update this every morning. I press Control Enter on my computer, get the new numbers and walk my dog. And then this graph comes up. So just over the weekend on Sunday, we saw a 70% reduction in travel on metro area freeways and on those statewide sensors, those automated traffic recorders that are all over the place. And we really see, these like consistent reductions in travel over time. This is sort of truncated before the first COVID case in Minnesota, but you can see when the governor declared a peacetime emergency, when the public schools were closed, and when the stay-at-home order took effect, we really see these responses by the public, and we see it play out in the traffic data. This gray shaded area on the graph is the stay-at-home order period. You can go to the next slide. So those same data, and really that same graph, is getting sucked into this state dashboard that the governor talks about, I think, maybe the Friday before last. So you can see in the top right there, they're plotting the data from these freeway sensors from MnDOT and from the metro area sensors. And these data are updated daily. We compile the data and estimate its difference from typical traffic using a statistical model. And then we put all of our estimates online on our GitHub site, and which is a way of sharing code and data with other people, with the public. And then because it's shared online, the folks at MMB are able to just grab it and suck it into their this online dashboard here, which is really great. It's like a nice tool that we're using to make collaboration really seamless among all of our different groups. You can go to the next slide. Metro Transit has been working with their automated passenger counters to look at changes in ridership. And they're seeing similar trends, but really dramatic trends, reductions in travel. 9 to 5 commuter trips have really collapsed since March 16th when schools were closed. You can really see that playing out in the express bus ridership rates, which are the red dotted line on this graph. There was also a service reduction in on March 25th. So we're seeing levels of ridership decline, both in response to social distancing efforts, but also in response to reductions in service at Metro Transit. But overall ridership on the system is down 72%. They're trying to manage the system both to support essential trips and also to encourage people to social distance, to take transit only if they need. Okay, we can go to the next slide. And so this is just some of the research that we're doing around the COVID-19 crisis. We're looking at other sources of data to measure social distancing and also to think about how we can measure the return to normal using transportation data, but also survey data. And we're developing collaborations with other transportation scientists and data scientists at the University of Minnesota to help us do this work and to also encourage them to do their own research. We're also starting to think about what the long-term effects of COVID-19 will be both on ridership and Metro Transit and on travel generally, especially if we're anticipating a regional recession. And we're continuing to collaborate with MMB, MnDOT, Metro Transit, and other groups at the Metropolitan Council to bring these kind of research projects into the light. With that, I'll take any questions, and Jonathan and Eric are here also to answer any questions you have.
Thank you for your presentation. Any questions from council members? Check one more time. Any questions?
Oh, I see one hand.
Okay, I'm looking.
Councilmember Linnea?
Councilmember Atlas Ingebrigtsen.
Thank you. I'm not sure if you can see the raised hand that wasn't working in our other meeting, so I thought I would just go with an old and
yeah, I'm sorry, you weren't on my array, so I missed you. So thank you, Ashley, for pointing it out. Go ahead, Councilmember Atlas Ingebrigtsen.
Thanks, as we're figuring this out. Thanks so much for sharing. This is really exciting to see how we're playing a role in that broader information collection. And in my work this fall, kind of looking at other regional communities in the nation, this speaks to one of the huge benefits of us having such a formalized Metropolitan Council and collaboration and a regional approach. I just can't even think about how other communities can't do what we're able to do because of this. So I hope that that's a story that we're really capturing right now about the benefit of having our body formalized in the way that we are and doing the work that we're doing on a regional basis. So Chair Barber, I don't know how we memorialize that, but I think it's something that I hope just won't be missed as we understand our response in this and the information and access to collaboration and resources that we need to address issues on a regional basis really speaks to the value of us having the Met Council in general. Second, I just wanted to say one of the things that has been popping up for me is, and I don't know if we can do this from a transit perspective, but I was thinking about streetlight in our work that we've been talking about with parks is with the increased park usage, is there a way that we could get to a point where we could help people know what parks or destinations in the outdoors are being highly used so that they know maybe when to go there or when not to go there, or as a way of keeping those places open, allowing citizens to know kind of, if you will, what's a green park, meaning not too many people, or a red park where there's way too many people on that trail. Stay away from that trail right now like we do with our roads. I'll mute myself. Thank you for your work.
Yeah, Madam Chair and Council Member, I can take a stab at that question and then maybe let Jonathan jump in here as well. So we are actually looking at streetlight data. You mentioned streetlight data to see what kind of insights we can gain from streetlight that we're missing from these traffic sensors that are really just measuring travel on highways. And I don't know when the last time was you all traveled on a highway. I kind of just drive to the grocery store and then back home to my house like once a week. So like travel is really changing in the area, and there's pedestrian and bike travel that we're just not capturing because it's not crossing on our traffic sensors. And there are some groups at the state, at MnDOT, that are looking at, that are using streetlight data to look at some of the park usage estimates. The challenge with streetlight data right now is the data lag. Well, one of the main challenges is the data lag. Right now, they're providing us data that is the first 2 weeks of March is the newest data that they're able to provide us, which when they gave it to us was only 2 weeks old, but now it's nearing a month old. So it's starting to lose its relevance. Although, you know, we're still getting great insight out of it, looking at these sort of like early trends, early responses to COVID. And so that's a really great thing. And we have some researchers or a researcher at the council who's really versed in the park use estimates and using streetlight to look at that as well. And I think she has plans to look at it, but Jonathan can probably comment on that. So yeah, the data lag is really a challenge. Although streetlight has started providing some closer to real-time data that we can use, is pretty aggregate statistics. It's like how much movement is there happening at the county level. So that's definitely not going to get at your question about usage at the parks. Yeah, so it's definitely a challenge to get real-time information. I wish we could do something really cool with that, like those Google, like, you know, how hot is this spot? What is that called? You can even look it up on your smartphone to see like how many people are visiting your favorite restaurant at a given time. But I think that would be pretty far off. Jonathan, do you want to chime in here with anything?
No, I think you answered it pretty well.
Okay.
Very good. Additional questions from council members?
I think I had my hand up, Reva.
Okay. It's not showing up on my side, so don't be afraid to speak up if I'm not seeing it. So, Councilmember Chambliss.
Okay, thank you. You did answer a lot of my questions, Ashley, regarding how what tools you're using in addition to your traffic sensors, and providing that information to MnDOT. And I'm not sure if that's traveling all the way up to the governor, but I know as in terms of social distancing, we get a regular daily report from the Minnesota State Department of Health, and also information from the health commissioners. Looking at that data, it's apparent and what's been reported from those daily conferences that Minnesota is doing a fairly decent job of keeping hospitalization and deaths down in the state. It would be interesting to see that data researched. It's now being disaggregated by race, but some of the trends are very curious in showing that you know, people of color have a lower hospitalization and death rate. And I'm wondering if that is related to, if that's related to reporting of cases and deaths. And I know that's something that kind of shows how important it is to disaggregate the data, because when it's time to respond, when we have an issue in a specific community, it's really important to be able to be responsive because we've already been collecting that data. So I just wanted to bring that out as well.
Yeah, I can, Council Member and Madam Chair, I can respond to that a little bit. One thing that we're looking at, Council Member Chambliss, is we're looking at data from Cubic, which is one of these big data purveyors. They actually provide the location-based service data that gets aggregated and anonymized by Streetlight before we use it. So they're sort of like the raw data providers. And they recently published some of their data in an online dashboard that disaggregates movement trends, not by race, but by income at least. So you can look at how movement is changing, measures of movement, I guess, which is some sort of proxy for how well how well people are able to social distance. You can look at this disaggregated for the highest income census tracts and the lowest income census tracts. And the trends are pretty clear, and the disparities are what you might expect, where census tracts from the lower income brackets are not reducing their movement as much as people from higher income census tracts. And before COVID-19 broke out, and this is true for Minnesota and for metropolitan areas across the country, although our disparity is, at least according to their dashboard, pretty great. So I think that this is data that we want to continue to look at and to hopefully get access to a more data-friendly way of looking at it. Right now, you can only download the data as PDFs, which is just like a static image. And so we don't have it in like a spreadsheet. But as soon as we have access to sort of the spreadsheet form of the data, we want to suck that in and start looking at that ourselves. Jonathan or Eric, do you have any comments on that?
Yes, Madam Chair, I have one additional comment, which is that MDH has been asking us, and one of the reasons that we've been looking at the traffic sensor data at a really low geographic level is to try to identify parts of the region that are able to social distance more, to try to identify hotspots at the lowest level possible. Ideally, they would like to know blocks where movement is decreasing more or less in order to be able to target messaging, to be able to encourage social distancing as much as possible, as broadly as possible. And so that's really why we've been doing this on as low level geographic level as we can. We've been publishing much of what we've been publishing on a high level. We've been providing it to NMB and to MDH at a very disaggregate level, at the traffic sensor level, so that they can disaggregate.
Ashley, could I just add one thing?
Yeah. Mm-hmm.
Sorry, Madam Chair and council members, it's Eric Lind with Research and Analytics Group in Metro Transit. And I just wanted to say this is one angle that we're looking at as well with transit. The difference that's important to remember when you're talking about social distancing on transit is it's not just about the movement and the origin and destination, but it's actually the trip itself is a challenge for social distancing. And so just wanted to emphasize that we're trying to manage that by looking at loads on a trip basis, time of day basis, to add service and to use bigger vehicles where possible to accommodate all the trips that are still happening and to make sure that we can still support all that essential travel in a safe way. But so we're definitely seeing geographic, distribution of travel and route based distribution of travel, which probably would indicate there's different patterns of travel by race that are going on transit right now. Unfortunately, it's really hard for us to get good information about who's on board right now without the ability to go out and survey people and otherwise interact with them, which we can't really do. So we'll continue to watch that, but I just wanted to emphasize that we're, have that dual problem of just the movement and also the social mixing along the way.
Thank you. Councilmember Chambliss, did you have an additional question?
Oh, no, I just thank you for the responses. Again, just the way that we're collaborating with Minnesota Department of Health, from MnDOT and the governor's office is great. The data that we have and the tools that we have already in place, including the disaggregation, allows us to be responsive to where those hot spots are. So that's where the value comes in. The responsiveness in times like a pandemic are critical. Thanks.
Thank you. Any additional questions from council members? All right, then I will say thank you to you all. This was really interesting, and I hope that I would like to kind of see you guys come back again at some point to kind of see how this changes, both as we kind of go through the stay-at-home order to when we start things start changing and people start moving around a bit more in the future. But fascinating data, so thank you very much.
Thank you.
Okay. Next, we are on to our next information item, which is the 2040 Transportation Policy Plan update. We have Amy Benowitz.
All right, can everyone hear me?
I can hear you.
While Greg is getting the PowerPoint set, I thought I would make a comment on one of the semi-questions that Council Member Atlas Ingebrigtsen brought up regarding the value of the Met Council. And I would relate that back to not just the Met Council itself, but the different functions that we have at the council, whereby we have planning and we're able to connect that to operations, and then our closeness with the governor's office. And one of the things I've been hearing nationally, I've been participating in some conference calls with other planning agencies across the country. And what I surprisingly heard is that some of them are having issues with conversations about their relevancy at this point, and that their agencies are kind of thinking, what's the value of doing long-range planning at this point in time? And my response to that was, we're a little bit opposite here in the Twin Cities, because the value in the long-range planning is connecting it eventually to operations and having that back and forth and kind of iterative process. And so I appreciate your thought on that, and that I think the value of the council really is emphasized at this point in time. And then specifically our ability to connect housing and transportation and planning and wastewater and parks and all of these different functions is really important, and probably something that once we get past this event, we will be having national conversations about the type of activities that should be connected together in various agencies. So anyway, just a quick side note on that, and I'll dive into the presentation, which you can all see here. So we've been talking about the Transportation Policy Plan for a few months now, and today I am going to specifically cover the schedule for the update, the work program chapter, and then specifically recent changes that we've made to the work program chapter in response to the COVID-19 event. And overall, we've been emphasizing that the TPP is not making significant changes during this update. They're very limited. The one exception to that comment is that the work program chapter is undergoing more significant revision, and that's why we're going through it in detail today. I was likely going to cover most of the items at a very, very high level, move through the slides pretty quickly, with the exception of the COVID work program items. But if you have questions along the way, just stop me, and or we can go back to them at the end too. So on slide 2, you see the proposed schedule for the TPP update. The schedule has not changed from when we originally suggested and entered into the update activities. We are continuing with the plan that the council will recommend release of the update for public comment on June 10th. We'll have a 45-day public comment period. Through August and September, we will go through a revision process in response to the comments that we receive. TAB will again look at the TPP in October and recommend it for adoption, and then in November we will have the full council adoption. So while we are suggesting that we continue on this schedule, as we move to slide 3 here, what we did not want to do is continue on without specifically recognizing the COVID-19 outbreak event. And that would have not been appropriate at this time to not at least acknowledge that a very significant event is occurring, has occurred, and that this event is really going to have very significant short and long-term impacts on transportation and how we plan for transportation. But what we also want to acknowledge is that we really, at this point in time, don't understand the impacts from the COVID-19 event, and fully understanding the impacts and particularly the long-term changes is going to take significant time and analysis. And that is what we will be doing over the next 12 to 18 months to 2 years. And so recognizing that also significant amount of work, we are changing the TPP work program chapter to incorporate 3 specific new planning studies, but I anticipate that almost all of our planning studies will have to consider the COVID-19 event in some fashion or manner, or at least go through a thought process of understanding why or why not that the COVID event had an impact. So moving on to slide 4, the new work program items are focused in 3 areas. The first, and this is really Jonathan and Ashley and Eric's area, and this is looking at our travel data, specifically our household survey data from the TBI, but also other travel data that we can either buy or currently have at our disposal. Looking at the trip purposes, how essential trips versus non-essential trips were impacted, looking at the impact of telecommuting and also online commerce, which has increased greatly during this event, and kind of just taking all of that data and sorting it out, and then helping to understand what are the short and long-term changes that we're seeing due to the COVID-19 outbreak. One thing I wanted to mention is that Jonathan Ehrlich is right now in the process of getting a consultant, our TBI consultant, to do a special survey of households that participated in the household survey in the past year. Many of them indicated that they would be willing to continue to participate in some manner in future surveys. And so we're hoping to get a survey out to those households in the next few weeks and really start to understand how their travel has changed from when they took the TBI a year ago to the travel patterns that we're seeing today. And so that will be an important piece of work, and probably one that we're able to do given that we were already doing the TBI survey, and probably will have some national significance, I'm envisioning. So the travel behavior is the first piece that we'll be looking at. Also, the other major piece that we know is that our transportation system finances are very changed during this event. We have many revenue sources, and almost all of them have seen significant impacts, some to varying degrees, but really all of them are down. And so understanding the short-term impacts on our revenues, how the long-term growth assumptions might need to change, and then understanding what might need to change about our planned spending, particularly in the current revenue scenario of the TPP. That work will be significant. It needs to occur for both the highway and the transit systems. And so we'll be partnering heavily with Metro Transit, our own finance people at the council, and then also the MnDOT financial leaders. We anticipate that this work will at a minimum lead to a fairly major amendment to the TPP. I can't at this point in time predict when that might occur, but I would imagine 18 months to 2 years out, we would seek to incorporate that the new growth assumptions and any new spending adjustments that we would have to make. The third major piece of work related to the COVID event is looking at our aviation system. Again, a system that has undergone some very, very rapid and significant changes in passenger demand and the need for capacity. We would, in the long term, want to understand how business versus personal travel has changed, and are those changing at different rates and for different reasons. And then simultaneously, the revenue impacts, not just to the airport, but also to the airline industry in total, and how that might change how we develop our airport system here in the state. So those are the three major studies. One thing I should emphasize, and we heard this last week from our TAC planning group, which gave us feedback on these studies. Each of these studies will also need to have an equity component. Probably the travel behavior and transportation system financial impacts a little bit more than the aviation one, but all of the work really needs to be taken apart across our communities and understanding how the changes impacted different populations in different ways and how that might change our decision making going forward. So one thing we are doing in response to what we heard from TAC planning last week is throughout the TPP, when we talk about our COVID-19 work program items and where there are impacts, to always also mention the equity impacts that we're seeing across our communities. I think I'll pause there and see if there are any questions specific to the COVID-19 work. And then as I go through the remaining work program items, I'm going to go through them, as I said, pretty quickly.
Any questions from council members?
All right, well, if, again, feel free to stop me. So moving on to slide 5, the work program chapter is somewhat divided into modal work program items that we will be conducting. Within the highway area, we have, and then I should note that on these slides, the bolded items are new to the TPP and likely items that you have not seen in the past. And so those are the ones I'm going to spend most of the time giving a little bit more detail on. So within the highway program, we continue our congestion management process plan work, the federal highway performance measure tracking, and then how that relates to our funding decisions, regional solicitation before and after study, and then continuing to look at connected and autonomous vehicle development. On slide 6, the new item to the highway work program is the assessment of regional congestion mitigation philosophy. And this is really a project aimed at, as we do the TPP, going out and having conversations primarily with our technical partners, the cities and counties and MnDOT, and making sure we all are on the same page about how we approach congestion mitigation within the region, what our priorities are for spending, some testing of the buy-in to our MnPass concept, which is one of our major mitigation policies for congestion, and then tweaking our approach to congestion mitigation, and with the major update that we do in 2024 for the 2050 plan, incorporating the results of that outreach work. So moving on to slide 7, this is our TBI work. Again, this is the work that Jonathan Ehrlich leads. I just covered the travel behavior inventory program and the new travel survey that we'll be doing. All of that work comes in, provides new data, and then we use that new data to update our regional travel demand model. And we do that on a continuing basis. On slide 8, we start with our transit work program items. We have the transit finance report, which is a 2-year report. We did, and this is what I was referring to earlier as part of COVID, we really need to look at the total system comprehensively again, and we just had that finance report. It was originally to be due this October, and it has now been extended into February of 2021. We are in the midst of the bus service allocation study. A quick reminder that there is a workshop for that study taking place next week on April 22nd. It's an online 4-hour interactive workshop. So if you haven't registered for that yet, I would encourage you to register for that and participate, as our policymaker participation is key to that work. We have Metro Transit's network next. You can't, that's very difficult to say 10 times. And that work, I think, is a little bit on pause during the COVID-19 event and will be starting up again in the summer and fall. And then we have 2 new studies highlighted related to microtransit and shared mobility, and then also a mobility hub planning. If we move on to slide 9, with the shared mobility for the TPP is still somewhat of a new subject, as not really fleshed out. And so we need to develop more policies and strategies to define how shared mobility will move our region towards our transportation goals and outcomes that we're trying to achieve. That will be an ongoing piece of work. Again, this is also a piece of work likely changing due to the COVID-19 event. And then we have heard particularly from cities interest in developing mobility hubs that combine transit, shared use bike, scooter, pedestrian type development, and defining the various roles that hubs can play within the region and the various sizes and activities that should be shared at mobility hubs. That work will likely be led by Metro Transit. Slide 10, our bicycle work program. We continue development of the regional bike transportation network and refining that network. We are updating our system inventory and continuing with our bike and ped counts. On slide 11, this is specific to our pedestrian work items, but one of the key items is a pedestrian safety action plan that we are just now getting underway. We have seen in recent years increases in our pedestrian accidents and fatalities beyond the other types of crashes. And I would also add that during COVID-19, we are again seeing an uptick in our pedestrian fatalities. So work specific in this area will be important to develop strategies on how to mitigate those trends. Moving on to slide 12, our freight program items. The main change there is just updating data that we use for the regional truck network to establish that network, and also some work led by community development to develop an online tool that is for use by cities to help prioritize land for industrial development. On slide 13, our aviation work. We have the COVID-19 system impacts, which I already covered, and then we were scheduled to do a regional aviation system study that would incorporate the results of the MSP long-term plan. At this point, we don't know the schedule for this system study. It really needs to wait for the COVID-19 system impacts to be realized, and also for MAC to finish its own long-term plan for MSP. And so that one hopefully will be completed by 2024, but we'll have to be developing a new schedule for that. On slide 14, we have a general system planning work, again, putting emphasis on transportation safety, planning and priorities. We had overall equity analysis for transportation. As I mentioned earlier, a lot of our equity work really needs to be incorporated within the studies that we will be conducting, and specifically within the COVID-19 planning studies. We have an electric vehicle planning study on slide 15. It gives a little bit more detail on that work. That still will be a priority for us moving forward, but we know that the adoption of electric vehicles has likely slowed somewhat, at least in the short term, due to the COVID-19 event. So we will be looking at the impacts on overall vehicle turnover and vehicle purchases and how that might change the adoption of electric vehicles within the region. And then slide 16, we have work related to creating an inventory and the ability to do planning scenarios for greenhouse gas emissions. This work is led by community development, and it will be an interactive online tool for communities to get information on how various strategies and implementation strategies and changes within their community can impact the greenhouse gas emissions of their specific to their community. And then finally, on slide 17, we did bring the work program to our Transportation Advisory Board and got some feedback. This was prior to the COVID-19 event, so some of their feedback really didn't take this current event into account, but they did emphasize to us that they would like to see planning studies that really did a holistic look at how transportation, the economy, jobs, and housing are all connected, and how moving forward on all of those fronts really can make our region more competitive. And then on climate change, they emphasized looking at system resiliency to climate change and how we plan for a resilient system, and also continuing focus on the transportation issues and needs of the disabled and elderly populations within the region. So that is what we heard from TAB, I think a month ago now. And with that, I will stop and happy to take any questions you may have.
Thank you. Any questions from council members? Councilmember Chambliss.
It's good to be able to focus on the transportation planning timeline. My questions are, I have several questions actually. The first one, you mentioned that we will be focusing in on the equity components and impacts through the studies and TBI. Are we going to be disaggregating that data by income and race? That's one question. And then the second question is regarding network next studies and the arterial bus rapid transit. I'm aware that we are looking at an environmental impact study for bus rapid transit along Highway 252 and 94 corridor. I think that would be included. I wanted to confirm that. And then lastly, on page 17, there was a note about resiliency to climate change. As we can see with the COVID pandemic, resiliency is even bigger in terms of the health of our region and health equity in our region as well. So, I think, our eyes are wide open. Even though it's a difficult time with the pandemic, it allows us to look at areas where we can improve. How are we doing during this this pandemic, where are our areas of strength and weakness? And I'll stop and let you respond.
Madam Chair and Council Member Chambliss, I am going to turn a couple of those questions over to others. First, Jonathan, do you want to respond to the disaggregation of the TBI data?
Yes, Madam Chair, Councilmember Chambliss, and Amy, we will be disaggregating TBI data by race and by income.
Thank you.
And I want to clarify that that is only within the people, the households that took the household survey were able to do that.
Thank you. Do you know how many people of color are participating in that survey? Or low-income people?
I don't have the numbers offhand, but I can get those too.
Okay, thank you.
Jonathan,
go ahead.
I was going to add that we did do specific outreach efforts to those communities to try to make sure that they were adequately represented within the TBI survey overall.
And they're slightly underrepresented in the TBI survey, I would say. And African American and Latino households are slightly underrepresented in the survey because of somewhat lower response rates. We tried to mitigate that as best as we could through outreach and through post-survey weighting. So we have fewer households than we would like to, but we do have enough to do data disaggregation and to do meaningful data analysis.
Well, that's great to hear. Thank you. Related to that is the resiliency question. Any response to what I said in terms of what that brings to light in terms of our strength and how we're doing?
Yeah. Well, I would respond to that, Council Member, Madam Chair, and Council Member Chambliss. I think that's a great point, and it's a conversation we really have to have more holistically, just not with the transportation. This work program is specific to transportation, and what we really need to do is get together with our community development division, environmental division, well, all divisions across the council, and particularly after the COVID-19 event, and say, what are the work program items that really cross boundaries and cross lines for us, and what do we want to jointly commit to doing, and how do we focus that? What is that work, and who leads it? But I think that's a great point. It kind of is the same type of point, I think, that we were hearing from TAB, in that, you know, you're looking at a transportation work program, but what they really want to know is, but how does transportation connect to jobs? How does it connect to housing? How does it connect to community resiliency? And so bringing it up a level to say, how do all of these things need to be thought about together? And we are more than happy to be part of that. And I think we need to do it, but it's a conversation that's broader than just my staff, I think.
Okay, thank you.
I don't know if Nick or Wes wanted to add anything. You had a question about the Network Next work.
Yes, in relation to the transit corridor studies and possibly expanding the arterial BRT to the Highway 252 and 94 area, the study, the environmental study.
Yeah, this is Nick. I can talk about the 252-94 is that there was a recent communication that went out under MnDOT, District Engineer Mike Barnes and myself, talking about how that corridor study that was in the works is changing over to an environmental impact statement. And so that'll expand that study to be more comprehensive. And within that, it's a commitment also to study the BRT within that corridor study as an alternative within that. So that is a commitment that's going forward with that study. I've not seen the schedule yet, but that will get underway this year. And then I don't know if on the network next, I'll defer to Wes if there's any updates on that.
I wonder if Wes had to drop off. I could probably answer just a little bit of that. We're continuing to work on Network Next, certainly with an effort to focus on prioritization of ABRTs and how do we look at that. Clearly, there are going to be some differences in what we do based off of what's happening with the system now, but because some of those efforts were on timelines, we're continuing to keep working on them. But the scope and sort of the rollout of different pieces of it might be different as our staff has to work on different things at different points in time. But I expect we'll have more information on it probably even by our next Transportation Committee meeting, what the direction is.
Awesome, thank you.
All right, additional questions from council members?
Chair, this is Councilmember Atlas Ingebretson. I've had my little hand up, but I'm gonna turn it off and just type in if that's okay.
Go for it.
Thanks for those earlier questions. I just Amy and I think it's Jonathan, and this isn't so much as a question as just a hope. Given everything that's transpiring nationwide with the impacts that disparities are having on African Americans, and I suspect that we'll see similar situations in tribal communities and other employers, I just want to say I hope that we can get to a point where we're no longer dealing with underrepresentation of those populations who are impacted the most by the implications for disparities and systematic individual racism when it comes to situations like this. So if I just want to hope, I know that Jonathan shared that it was slightly underrepresented, but I hope we can get to a point where we're not underrepresenting populations who are suffering because of disparities so unfairly.
Yeah, I think we would agree. And we did make, Jonathan can tell what methods, but there were specific efforts made, and then they tried to make accommodations for how the surveys took place, but it was just difficult to get and I think when Jonathan says underrepresented, it was given the percent of the population and then the people that actually participated in the survey, it was a lesser percent than in the general population. Is that correct?
I would add that continues to be a concern of ours. One of the ways that, just add two things. One of them is the first step in recognizing underrepresentation is asking the questions and determine to what level you are seeing underrepresentation. I know we've seen underrepresentation of people of color and underrepresented groups in general in travel surveys for decades, and we just didn't know specifically how much we were for most of that time. Secondly, we're constantly monitoring research methods to figure out what are the best ways of reaching more people and in more innovative ways as we possibly can. That's the most important thing that we can do in our surveys, and one of our highest priorities is to constantly tweak our methods and to change our methods if we think that we are systematically missing people, and to realize that some of those things are also out of our control. There are lots of reasons for some people to be distrustful of government, to be distrustful of taking surveys, and people who aren't willing to respond to our travel surveys because they're distrustful of the council because they're afraid of the council, because they're afraid of how information is being misused, are not entirely wrong in not participating. And we need to recognize that that the systematic racism that causes that level of distrust is not something that we can control, but it is something that we can recognize when we look at and analyze our data as well. So but we will continue to do the best that we can in alleviating and reducing underrepresentation as much as we can.
Chair, if I could, I would offer that the Met Council is not the only group who collects data on folks and has underrepresentation and information collected. The school districts do it, other state agencies do it. What I would offer is when in my time at Minneapolis Public Schools and needing to collect similar types of data and surveys, using a phone survey was highly effective, especially using phone surveys in different languages, and allowed us to create and collect representative feedback. And so I do think that the method by which things are done is essential and really important. And I think that we and our institutions need to grow and change and not allow having not complete information be the method by which we make decisions. And I just continue to encourage you to seek out better methodologies and seek out other institutional groups who are being successful at collecting data and from the same populations you're looking to collect data from.
All right, Councilmember Chambliss.
Well, thank you. I just wanted to also mention that I have participated in diverse community groups, the health engagement equity cohort that was very successful in engaging various communities, and that they had best practices that really did work and really did speak to getting information from the communities. So I'm open if you have questions or if you'd like a referral.
Great, we appreciate that.
And perhaps in the future, we should have Jonathan and group come back and do a presentation on the various ways that we do conduct right now the TBI, but then other, have a discussion around maybe some potential opportunities with that. Might be good. All right, additional questions or comments from council members? Trying to scroll through all of you, make sure I got everybody. Okay, then we're good. All right, thank you, Amy.
Thank you.
All right, so with that is the end of our agenda. I do want to make a note for council members and for anybody else watching that originally when we first started the link to the presentation, the highway and transit travel reductions due to COVID-19 wasn't live. We fixed that, so it's live. So if you want to go in and check out the presentation and go into the various links that Ashley had mentioned, you should be able to get to that now. So with that, any other questions, comments from council members? All right, if not, then we're adjourned. Thank you all.